distinguished Chairman, Director of the Sarvodaya Management, my colleague, friend, Captain Bobby Ramesh, dignitaries and industry experts, my colleagues from across the nation, and the lovely nurses seated here in this audience. It indeed is a great honor, a pleasure for me to talk on a such needed topic, transitions and transformations in healthcare. And this is so apt for nurses of this century. Ladies and gentlemen, I do not have a slide here because I notice when we have slide presentations, most of you keep looking at the slides and you barely listen to the speaker. And I, for one, am very attention seeking. So all eyes and ears to what I have to say. Please give me this time. I'm not a subject expert in talking on transitions and transformations, but I definitely know that what I speak comes with immense experience of 30 plus years, which cannot be discounted. From the intense reading that I demonstrate and my experience of visiting many countries to see what healthcare is all about. So what I say because this is what I believe, and I'm very candid, and with conviction I would state this. So this is not to offend anyone, but these are powerful statements and my belief. The history of healthcare is like an epic involving service, sacrifice, trials, triumphs, ambitions, aspirations, and so much more. And this is so apt for the nursing service. It's been an evolution. Our healthcare landscape is like a paradox. It perpetuates hierarchy, even today. And this is owing to its traditional, orthodox, rigid structures. We've come a long way. Things have changed, but we still understand that there is an unequal power base which is tilting largely towards the provider rather than the receiver. But this change is just around the corner, and things will change for the patient, and it will also change for nurses. I have this strong belief. Today, we are witnessing an evolution of a revolution. Technology is taking center stage. We know this is the time of artificial intelligence, big data, cloud computing, digitization, and so much more. We are seeing a proliferation of public-private partnership. We see a lot of reforms and policies that are being formed in the country today towards healthcare. We are a witness to the brain drain which affects the healthcare today. All of us have crunch of resources. There is increased patient literacy, growing consumerism, litigation, media outcry, and of course, we all are passing through the aftermath of reforms like demonetization, GST, insurance, and so much more. This has had a significant impact on nursing and on healthcare at large. So in this cacophony of medical jargon, evidence-based clinical trials, which has prompted us to do work first of its kind, breakthrough, innovation, enabling us to deliver care with mathematical accuracy and robotic precision. One thing is very clear: nursing has transformed very little to the expectation of the century today. So there definitely is a problem which we must accept, understand, and change. Healthcare, ladies and gentlemen, especially to the nurses who deliver care at the front line, is going to be a consumer-driven market. Today, with an app for everything, virtual healthcare models have evolved. They will proliferate, they will disrupt traditional modalities of care and treatment. And we nurses have to embrace this change. According to the Lancet Medical Journal, the study on global disease burden, it states that India ranks 145th amongst 195 nations. I agree that the health access and quality index of our country has moved from a whopping 44.8% to a 67.3% from 2015 to 2020. That's great. And this is the latest report of January 2024. But we have a significant problem that faces our country. And nurses have to be aware of what is happening in our country to be a part of this transition and transformation. We still have this formidable challenge of a steep divide between urban and rural healthcare. And nurses will play a huge role in National Rural Health Mission. And I'm glad the country is moving towards a lot of investment into auxiliary nurses, supported by nurses, to drive the health mission of our country in the rural areas. The World Bank and the National Health Mission states that 70% of healthcare expenditure happens out of pocket, which is huge. And every nurse must understand these dynamics. In a country like ours, more than 66.2% of expenditure on overall healthcare happens out of pocket. It has driven families to impoverishment. This is huge statistics in our country. So rationalizing the use of materials and enabling communities and families to move towards preventive healthcare, especially when we are faced with the burden of communicable disease and non-communicable diseases, which our country has become prominent in the global map for cancers, cardiac diseases, diabetes, and now obesity and other metabolic disorders. Health insurance. Though 37% of our population has been insured under some scheme or the other in 2015, that's just a mere number. Though insurance is a growing market, it's naive in our country, but it's growing. Nurses must understand that every bill that they transact, which has an insurance cover, will not be paid to the patient if there are increased average length of stay, if there is an error or there is a wrong test order or anything that is consumed beyond what is expected of the insurance of that patient. The pharma sector. We all know that India is one among the third largest exporters of pharma products in volume. We know that 80% of our market is with generic drugs. Nurses have to understand every molecule that enters into the market. They must understand medication reconciliation, and they must advocate and own this process. And they must take lead in antibiotic stewardship. The medical device sector has changed its export-import rules. Regulatory norms have been eased out, and nurses play an important role in validating the products, the consumables that you used. And there's a lot of effort towards making India products. So nurses have to now move beyond just the basic care that they give to the patient and understand the healthcare market and the scenario that prevails in the country. And we have to be in the middle of this consumerism vortex. Otherwise, institutions will not be financially sustainable and viable. And nurses play an important role in clinical outcomes, in patient safety, in accreditations, in the practice of every clinician, and the reputation and reimbursement of the organization. Nurses have to be the front and center of this. The law and ethics of medicine will be governed in future by the paradigm of the patient. So this will play a vital force in legal and public policy formulation. So how much ever you dread, you loathe, you lament, you critic, despite all the attrition that happens in our country, it's important for us to understand that we have a larger role to play as advocates of healthcare. So leading this 21st century healthcare needs innovation. Whether it is a simple change or a radical redesign, something new and different seems to be the ask of the organizations today. And nurses will have to continuously brainstorm to understand how can we innovate and how can we get better value, how can we drive down costs. This is an important segment that is the most valuable in an organizational hierarchy. Patient safety. Nurses play the most vital role in patient safety. We all know 1 in 10 patients are harmed due to errors. We know that 3 million patients die every year due to adverse events. And in a country like ours, we do not have a data repository and a national data bank to even project what is the current scenario. We all understand we've come a long way from the time people said to err is human. And I say that, every day we wake up to some error or the other because somebody has missed a step. To err is human. To cover up is unacceptable. And the failure to learn from our mistakes is criminal. While we have untangled many roots and we have found solutions to some of our problems, we are standing in front of formidable challenges and things which we've never seen before. Did we ever realize that we would experience a pandemic in our lifetime? Did our training not bring in and forth the foundation that we had to deal with the COVID pandemic that we were part of? Nurses turned spotlights on them. The country celebrated the nurses. The country put the nurses up there in front. So it is time for us to take off from there and leapfrog into the next era. I'm so proud that we as nurses, along with the doctors and the rest of them, worked to put our country back prominently on the map. And we're all here alive today. We all have a great foundation. The founder of nursing, Florence Nightingale, a known researcher, statistician, a person who's revered and who's immortal, but we still are on a shakable foundation. I say, Florence Nightingale, if we could build a stairwell of tears in a memory lane, we would all go up to heaven and bring you back home again. We need so many more researchers. We know we need specialist nurses. Today, it cannot be an era of general nurses. And I'm glad in the last 15 years, we have infection control nurses, we have wound care nurses, we have stoma nurses, infusion nurses. But today, we need to move to super specialty. Every cardiology unit should have a super specialist nurse. That's what the global world is all about. So be it in neurology, in transplants. We need doctorates in nursing practice. We need nurse practitioners. So this whole healthcare today is standing at the cusp of a digital revolution. And nurses play the biggest role in providing inputs to develop products for digitization. And I'm glad many of us are doing it. So today, ladies and gentlemen, we have to come out of our comfort zones. And in this entire game, I think the most important is leadership. Earlier, we had only nurses from Kerala. Today, we have nurses from all over the country aspiring to become nurses, because nursing, according to the Business Week, is one among the 19 fastest growing professions in the world. It is saying that amongst the 20 healthcare jobs, it will be for nurses. So today I'm glad nurses have done well. They've gone to the best countries in the world and they have become the source of economic engine of our country. So, ladies and gentlemen, nurses have to be the linchpin of healthcare reform. They should be involved in civic involvement, in environment sustainability. They must have a respect for diversity, inclusion, pluralism, and so much and so forth, along with freedom of expression. So let us propel ourselves with an undaunted curiosity. Let us have an obsessive optimism, a compelling compassion to do better for healthcare in our country. I understand there will be no single defining action. There will be no killer innovation. There will be no solitary lucky break. There will be no magical or miracle moment. It will be a hard job like turning a wheel, giant wheel, momentum after momentum till we get a breakthrough. A new form of leadership must emerge where there will be intellectual stimulation, there will be inspirational motivation, there will be individual consideration. Only then we can foster collaboration and we can take things forward for this nation. I'm so glad that we, as nursing leaders in this country today, as principals and others, are trying to reframe our options, reinterpret our dilemmas, and try and reform our operations. I'm so proud that when our country celebrated the 75th anniversary of independence and the tricolour adorned the blue skies and we were showered with petals by the Indian Air Force aircrafts all over our major hospitals to celebrate the heroes of healthcare, the doctors and nurses. We've experienced this for a lifetime. Now it's time for the youngsters to take this forward. And I'm glad we, as leaders in the last 2 decades, I must say, have given a great legacy for our youngsters where you will not be judged by social hierarchy, sexual stereotyping, gender, race, or color. So, ladies and gentlemen, as we step up to celebrate 2047, the 100 years of India's freedom, I'm sure India will find a prominent place in the global world map as a healthcare destination for many across the world. And nurses will continue to be the beacon of hope because we stand testament to the enormous healing power we have to offer to the troubled world. So, ladies and gentlemen, on that note, it's a borderless world with boundless opportunities. There will be challenges, but there are immense opportunities. So may this transition and transformation have huge amount of respect for nurses. May every nurse be clinically competent, socially sensitive, ethically engaged, strive for safety, have a quest for quality, and work without fear or favor. I especially want to note fear. Never fear. You are the legitimate entity and the heartbeat of healthcare. I will end this note on a beautiful 2 lines from a beautiful शायरी which says, फानुश बनकर हवा जिसकी हिफाजत करे, वो शम्मा क्या बुझे जिसको रोशन खुदा करे.